have Chief Medical Health Officer for the province of Saskatchewan, Dr. Saqib Shahab, here in the room. On the line, we have the CEO of the Saskatchewan Health Authority, Mr. Scott Livingstone. We'll start with a brief statement by Dr. Shahab before proceeding to questions for about 30 minutes. But before we begin, I will just remind everyone that in accordance with the spokesperson guidance during the election writ period, the Chief Medical Health Officer and the Saskatchewan Health Authority will provide only technical or factual information and will not participate in debate of programs, policy rationale, or defense of programs as promoted during the course of the election. Thank you. Dr. Shahab?
Thank you. Good afternoon, everyone. So, as we've all seen the news release, we have now 40 new cases of COVID-19 reported today, October 16th, which are throughout the province, but higher numbers in the far northwest, far northeast at 6 and 7, North Central at 8, Saskatoon at 7, Central East continues to have cases at 2 today, and Regina at 7. But other parts of Saskatchewan are also impacted. And now we are at 299 active cases. So our case numbers continue to trend up. Gatherings continue to play a large role in local transmission, but there are other trends that we need to be mindful of. We also have seen that since Monday, for example, we have added 54 cases in persons aged 20 to 39. So we are seeing a significant and definite trend in young adults aged 14 to 39. And the test positive rate in that demographic is also increasing at around 2%. So again, similar to other jurisdictions in Canada and Europe, we are seeing more cases in that young, active age group, which obviously are out and about at work, but also out and about socializing. So this is certainly a trend to watch and really a message to everyone, but especially people 15 to 39. So, we have to recognize that as young people have also always felt more invulnerable. It's the nature of being young. And anecdotally, young men also are particularly less risk averse. And also, people in their late teens and early 20s are less likely to watch media events like this. Public health is continuing to work to reach out through other social media platforms like TikTok and other platforms. But we also need to make sure that we as parents and friends continue to reach out to young people and have a discussion around COVID and be supportive of public health measures that protect all of us like mask use. We have heard that older people and those with underlying health conditions are most likely to suffer the most severe outcomes from COVID illness, but it doesn't mean that young people are immune. Even if you don't become seriously ill, and we have to recognize that actually we have had many people in their 20 to 40s admitted to ICU, but for the most part, even though young people may have a significant illness and recover at home, they can transmit it to a larger cohort, which can include their peers and friends who may have an underlying health condition, and it can include their parents and grandparents, and others who are older, who they may interact with socially or at work. And it can also put essential workers at risk, including those who work in healthcare, grocery stores, other essential industries. This week has shown with the temperatures coming down that, we have had a great summer, but the great outdoor Saskatchewan summer is now over. And we cannot bring the party inside. And that is especially why we reduced our gathering limits for 30 to 15. We cannot have the same backyard barbecues, the same events we enjoyed over the summer indoors in our own houses. Anyone who's not part of your consistent, close household bubble of 2 or 3 households or 2 or 3 close friends cannot be in your house closer than 2 meters. I think that will just continue and perpetuate transmission. And also, we have to make sure that even though we can still go to a bar, we have to follow the guidelines. Be served at your table. This is not the time. You can go with your close, consistent friends, but this is not the time to be mingling at bars. Restaurants, again, are following guidelines where you sit at a table of up to 6, and there are restrictions on obviously mingling with other tables, and we all have to comply with that. It's really important to wear a mask when you're in a transit bus, for example. carpooling with those who are not part of your essential household. We've seen transmission happening in co-workers, not just in the workplace, but also when, for example, carpooling. And whenever you're in an indoor place which is outside of your household, it's a great idea to wear a mask, especially when you can't maintain a 2-meter distance, when you're in common areas at your workplace, elevators, stairwells. It could even include common areas in an apartment building, laundry rooms, corridors, stairwells, elevators. It's really important to always have a mask and put that on, as well as, of course, physically distance, and stay home when you're feeling unwell. Finally, we all are looking forward to when the pandemic will be over, and it will be over sometime next year. We hope that there'll be a vaccine available early in 2021. But it is important that till such time, and especially now that we're entering the fall and seeing an upward trend in our cases, we revisit all the great things we've been doing throughout the year, and maybe relaxed a bit over the summer, but revisit some of the things we were doing in the spring. Meet more virtually. Only close friends and family should go to those essential events, whether it's a marriage, a funeral, other special event. You limit the gatherings to as small as possible, and otherwise celebrate and grieve virtually. We have seen transmissions at birthday parties, at weddings, even when they were under 30, wedding receptions, even under 30, have in some cases resulted in transmission to the entire wedding party. And unfortunately, funerals where we want to reach out to close family and friends, we have seen transmission continuing to happen over the last few weeks. So we all have to revisit the principles we applied in spring, and do more things virtually, stay home more as much as we can, reduce the number of visits we do to shop and other activities, and really we all have to play a part to bring our numbers down. Thank you.
Thank you, Dr. Shahab. We will now start with questions. We'll start in the room. Lynn?
Are you able to give more information about the business that had to temporarily close and the fines that were issued? Like, why are we not naming these businesses for not following guidelines?
Yeah, I think I would not like to name them at this point. I think generally there's lots of times when there's a warning letter that's issued to a business, and public health inspectors work closely with businesses to make sure they're complying with the guidelines. In some cases, there may be a ticket and fine, or in some cases, the business may have to close till they have corrected their protocols and guidelines. At this point, I'm not able to give that information, even if I have that. But I think it's a continuum, and I think the continuum starts with businesses following the guidelines to begin with, and us as customers complying with those guidelines.
Follow up, Lynn?
Yeah, we saw today a very lengthy list of business exposure alerts spanning 9 different communities across the province. Seeing that increasingly long list of business exposures, is that a concern for you?
So thank you for bringing that up. So actually, the fact that we're having more cases, and when we do contact tracing, we say, okay, while you were infectious, which could be 2 days before your start of symptoms, where did you go? And people, are out and about. They may have gone to a variety of places, and that's why with more cases and with more people being out and about, we may have gone to more businesses. And secondly, we thought, okay, is this valuable to have these many PSAs? And we have had at least 4 instances where people went to, looked at the PSAs, they started self-monitoring themselves more closely. All of us should be self-monitoring all the time because we all are out and about. But they did look at the PSA, they were self-monitoring, mild symptoms which they may not have thought much about, but because they had been to one of those businesses, they got themselves tested, they were positive, and then they were able to isolate and not transmit further. So I think it's important for all of us, if not daily, but every other day, to look at those PSAs, scan them, and depending on where we live, see, have we been to any of those sites on that specific date or time. It is helpful, but also generally, I think we need to just closely self-monitor ourselves at all time.
Thank you. Mark?
Yes, with private gathering sizes being reduced today, if that doesn't work to get the cases under control, what would be the next step for?
Yeah, so obviously we're watching our case numbers, and we're at around, between 30 to 40 cases a day. Certainly one threshold is, 5 cases per 100,000. So that would be 60 cases per day over many days. That's really a threshold we don't want to reach, but obviously that is a threshold that's been used by many jurisdictions, and certainly we would have to consider at that time that, okay, what further interventions we can put in place. Obviously, we went with the gathering size earlier before reaching that because we were seeing that even in those small gatherings, we were seeing consistent transmission. But that certainly we will have to monitor. And then, of course, the other threshold is 10 cases per 100,000, which for us would be consistent several days of more than 100 cases a day, around 120. Obviously, no one wants to be there. Many jurisdictions are there at or above those thresholds. And we have seen that, unfortunately, they have had to take the difficult decisions of keeping essential services going, like we have kept in Saskatchewan going all the time, trying to support our schools to stay open, because that is really important as much as we can, but then looking at what other businesses can be slowed down, if not closed. And I think this is the time we need to slow things down. We need to, like I said, just slow down our social contacts. The average number of contacts are around 8 per case, which is a bit high. They were around 3 to 4 before. The number of contacts range from 1 to near almost 200. So there have been some cases who had up to 200 contacts. So we all need to look at what are we doing at work, what are we doing at, when we go out and about. We need to just slow things down and bring our number of contacts down.
Thank you. Follow up, Mark?
Yes, how much concern is there for nightclubs? We've seen a number of exposure alerts linked to those. How concerning is that, and what might be done about that?
Yeah, so, COVID transmission doesn't magically stop in a bar or a nightclub. COVID transmission happens anywhere where you're closer than 2 meters and not wearing a mask. So, unfortunately, we have to apply those principles, whether we're at a funeral and grieving, whether we're at a bar, at a nightclub, at a birthday party, at a wedding. We have to really observe those principles. And it is hard because, there are certain settings where, you want to behave differently. And obviously we've seen, and other jurisdictions have seen that, if you, with alcohol and other things, sometimes that sense of control isn't there. But, I think we really have to look at all these venues, and especially bars and nightclubs, about how to keep things safer. Other jurisdictions have looked at lowering the music so that you don't have to lean into each other to talk. And maybe early closures. At this point, that is not being considered in Saskatchewan, but I think it is an opportunity for all of us to actually plan ahead that, okay, who are you going with? What's the plan? Best thing is to go with a small group, your consistent friends, sit at a table, have the drink served at the table, not mingle, and try to avoid those transmission events happening at any venue, but also especially bars and other venues.
Thank you. Moderator, we'll go to the phone line. First caller, please.
We have Guy Quenville with CBC.
Hi, thank you for your time today. This is for either Scott or Dr. Shahab, whoever wants to take it. I spoke this morning to the owner of the bar in Saskatoon that was flagged yesterday by the SHA, the Long Branch Bar, and they told me that the Saskatchewan Health Authority approved the use of plexiglass dance cubes by customers. The cubes were meant for up to 4 people from the same bubble, but given that our guidelines currently prohibit dance floors, and just given the general situation right now, why did the Saskatchewan Health Authority think it was a good idea to approve those cubes, and are you surprised that this business is now a potential COVID-19 exposure site?
So I don't have the specifics or the details, and I can certainly get to that, and I'll ask Mr. Livingstone to speak to that as well. But I think we do need to be cautious. I know that in general, bars, restaurants, other venues have done a lot of work indoors to try to, for example, put up plexiglass barriers so that people can, at specific tables, can not only be 2 meter distant from other tables, but have that plexiglass barrier and those kind of things. So I don't know the details of the context in which those may have been approved. But I think we do need to recognize that even when you're there with your small group of 6, for example, at a table in a restaurant, if they are not your household, you still need to minimize transmission even at that table of 6. And obviously you want to prevent a super spreader event and have transmission at multiple tables. But I'll ask Mr. Livingstone if you have any further comments.
Thanks, Dr. Shahab. And Guy, I'm not aware of that specific assessment or review by SHA, and I would assume it'd be public health inspectors of the plexiglass dance cubes. But I'll certainly have somebody follow up for you to see if that did occur. But I will say, and I think, as you know, the public health inspectors have been used a lot throughout the COVID pandemic to help support the reopening of businesses and provide guidance on how to properly adhere to public health orders. So it wouldn't be out of the question that could have happened, but I'm just not aware of it right now. But I certainly will have somebody follow up with you if that's okay.
Thank you. Guy, follow up?
Yes. As has already been mentioned, the list of potential COVID exposure sites seems to be getting longer by the day. Anecdotally, I'm hearing of people waiting 4 to 5 days to get test results. And we haven't yet reached our full capacity of 4,000 tests a day, even with school back on. So I'm wondering, is there a testing backlog in Saskatchewan? If so, how bad is it? And if so, what are you doing about it?
I'll give some specific comments on the first part of the question and then ask Mr. Livingstone to speak about the testing numbers and any backlogs. So I think it is really important, and as I mentioned last time, at the first sign of symptoms, we must stay home. So that will reduce the number of places we've been to, because if you get symptoms today, public health will ask you all the places you went to the 2 days prior to becoming symptomatic, and then if you went to 3 stores and 2 retail locations and a few other venues, all those will be listed as a PSA. But we definitely don't want to be out and about once we're symptomatic, so that will reduce the number of PSAs and also reduce the number of contacts who are potentially exposed. And we also need to work towards bringing the number of contacts we get closer than 2 meters for more than 15 minutes as low as possible. And for the testing, I'll defer to Mr. Livingstone.
Sure, and thanks for the question, Guy. So first of all, I'll talk about backlogs. So with respect to the testing backlog and capacity, our targets for testing, particularly for symptomatics, is a 24-hour turnaround on the test on a daily basis. There are things that affect that turnaround time, and particularly how and when those swabs arrive at the lab at the time of day, because there are cutoffs that we use with respect to the testing numbers on a daily basis. There are small, what I would say you could term backlogs if you're not meeting that 24-hour target. Or, for asymptomatic patients, our goal is to get the results out within 72 hours. We've typically been managing within 24 and 48 for the duration. As you've already pointed out, we haven't consistently met our testing capacity through, and what I mean by people aren't coming and blowing through our capacity on a day-to-day basis, and we continue to have demand testing going on, and we've gone up to 3,000 tests a day. What are we doing about it? Another good question. So as you know, we posted 76 new positions for the lab. We've onboarded over 50% of them. Our capacity is building daily. We've gone to pool testing for asymptomatics, which has expanded our capacity to asymptomatic testing. And we are still offering testings across the province to anybody who wants to test, not just symptomatic patients, although symptomatic patients are prioritized. And last but not least, just to highlight that we know that the testing environment is changing across the country. You know that there's been a couple of 2 tests, point of care tests that have been approved recently by Health Canada that will expedite testing because at least in one of the cases, but I believe both the audit devices coming out that we are currently validating don't require lab personnel to run the test. So we will continue to expand our testing. And we should see that being incorporated into our testing strategies across the province over the next few weeks, but certainly before the end of November is the hope.
Thank you, Mr. Livingstone. Moderator, next caller, please.
We have Kelly Skirvin with the PA Daily Herald.
Hello, Kelly, are you there?
Hi, yeah, sorry. Good afternoon. Thank you for your time. My first question is, so an outbreak has been declared at the Prince Albert Cooperative Health Centre. Is this outbreak related to the Full Gospel Center in Prince Albert?
I may not have those details. I don't know, Scott, do you have that information?
I don't, but we could get somebody to follow up. But I don't believe it is, but I don't know for sure.
Okay, thank you. And my follow-up question is, frontline agencies who work with the homeless say many of the people who attended the Full Gospel Outreach event are their clients. How hard is it to contract trace a transient population, and what supports are in place to protect the homeless population from COVID-19?
Thank you for that. I'll make some initial comments and then ask Mr. Livingstone as well. I think that's a really important part of contact tracing, that you have to reach all your cases and all your contacts quickly once a case is identified. And public health has been really working, full out to do that. And you are correct that when there's not a first of all, we all of us have a responsibility that if we go to any event or organize any event, we should have the names and numbers of all the people who attended. That makes it easy that if we were a case or there was a case at that event, you just hand over that list. That's the first thing that I think we all need to practice as business owners or as someone who's organizing any event or at any venue. And many places of worship, for example, have a registration process where you can only attend if you register. And of course, the names and numbers have to be reliable. Secondly, if there are challenges in reaching either the initial contacts or some cases, like for the PA event investigations, public health is already reaching to the second or third generation, because we've had, around 79 cases linked to that event. About it, half were the initial exposures, then there's already secondary exposures, and now there's a third generation, because COVID travels quickly. Within 2 to 8 days, you can get transmission to a second group and then a third group. So that's where sometimes the trail starts getting cold, and so public health is working very quickly to identify contacts of all cases. The Saskatchewan Health Authority is supporting with contact tracing, but of course we have to recognize that as the weather cools, if individuals are unable to isolate as cases or contacts, they will need support. So that's actually coordination with social services, municipalities, to support isolation if it can't happen in the home. Scott, would you have any further additions to this?
The only thing I would add is just at the end of that is part of the work with our most vulnerable is making sure that we use interagency collaboration, whether that's in the far north or in our urban centers with the community-based organizations, to ensure that we're getting testing and swabbing centers available where possible and helping folks understand how to incorporate public health orders into the day-to-day interactions with our most vulnerable people. But certainly to Dr. Shahab's point around, contact tracing and follow-up, it's important that we get on that quickly, regardless of where the events occur, and getting on close contacts as quickly as possible and breaking those chains of transmission is important, regardless of who's involved with the virus, because the virus doesn't know if you're one of those most vulnerable people or a person that's not vulnerable. The virus knows no boundaries.
Thank you very much. Moderator, next call, please.
We have Britton Gray with CJME.
Hello, Dr. Shahab. I'm just wondering why we haven't named that where the apartment complex is for that one in Regina. It's just we've been naming businesses that have had exposure. Wonder why the apartment complex hasn't been listed for people like post office workers, delivery people to be aware of.
Yeah. So first of all, I think we have to be obviously very conscious of confidentiality, and we would not like to name any jurisdiction where, like in this case, all persons in the complex and the group that runs the complex have been notified, and that would be similar to any other setting where where there's common areas of like an entranceway. Regarding people who may be visiting those places, I think we have to recognize that transmission haven't happened in the past. Everyone was contacted, things are under control. There's no further transmission happening. But in general, we have to be careful all the time. It doesn't matter if on a positive note, we all have seen that when we have people coming into our homes to perform, furnace maintenance, other repairs, most of the time you expect people coming to wear a mask, and they are wearing masks. All businesses have who are going out to provide essential services, and in this time of year, it's furnace, maintenance. They're all following COVID protocols. So businesses have gone above and beyond following COVID protocols to keep them and their employees safe, and to keep people who live and work in residence or office areas safe. So I think we have to follow those protocols all the time. So whether you're a postal worker or someone delivering a package, all of us have to observe those protocols all the time. But beyond that, if there's a cluster identified in a complex, notification is given as appropriate to all the tenants. But the reminder for us is now that our case numbers are going up, whenever you are in a common area where you are not with people in your essential household, wear a mask, keep that 2-meter distance. It could be a hallway, stairwell, elevator in an apartment building, could be a common laundry, it could be a common area at work, again, hallway, elevator, stairwell, and same applies to the retail environment, and not just to customers and employees who are serving customers, but we've seen a lot of transmission when employees may interact socially in a way that is a bit different and may let their guard down, and we've seen transmission happening in those. So even then, as you're interacting at a break, for example, with your colleagues at work, you still have to maintain that they're not part of your household bubble. You have to maintain that 2-meter distance and all the other precautions.
Thank you. Follow-up, Britton?
Yeah. So there's a story from the U.S. about a beer league, hockey league essentially becoming a super spreader. I guess, are you concerned that might be an issue up here? I know that obviously two very different things with restrictions, but do you feel like there's enough restrictions in place that sporting events, not just hockey, don't become a super spreader?
Yeah, thank you for that question. And I think there are two aspects to that are extremely important, especially because the case numbers are going up. One is that, we have seen with mini leagues starting in the summer that you can have play that is important for, mental and physical health in a safe manner. Children and adults have been playing in mini leagues in a safe manner. That means, smaller number of teams playing together, limited geography. During play, obviously, you can't avoid close contact all the time. But when you're on the bench, you don't get closer than 2 meters, even with your teammates and coaches. You maintain that 2-meter distance, wear a mask. We've seen that with professional leagues throughout the world who are modeling best behaviors. And similarly, obviously, maintaining that physical distance between teams as well. In March, we saw many transmission chains when these guidelines were not being followed. And, professional teams would be expected to have an even higher standard. But having said that, even with those higher standards which you've seen throughout the world, transmission sometimes does happen, but you want to keep those transmission chains small. You want to intercept them quickly, and sometimes that does result in game cancellations, and it's very disappointing for players and fans. But we can't obviously let that get out of hand, because even with young athletes who are younger and may have a milder illness, there have been reports of more severe illness even in young people, including inflammation of the heart and other factors. So it is not a trivial infection; it can't be ignored. But for athletes and children and adults willing to play, I think it can be done in a way to make it as safe as possible, but recognize that there will be transmission events, but all these protocols are there to prevent super spreading events.
Thank you, Doctor. Next caller, moderator.
We have Laura Sharpaletti with CBC.
Hi there. Thank you so much for your time. So you reported today that 79 people, including close contacts, are now connected to that Prince Albert Gospel Outreach outbreak. But you haven't announced any new restrictions for public indoor gatherings like church groups. So first, I'd like to know why not. And second, I'd like to know, what point we have to reach in order for more regulations or more restrictions to be put into place.
So I think this is a time for all of us to reflect on our activities, what's essential, what can we afford to do safely, what should we avoid. Just like in March, April, this is a time to revisit that as summer has ended, fall has started. So even for places of worship, many people chose and have continued to attend virtually, and that's great. I think if people were attending in person, this is a time for them to think, are they comfortable attending in person or go back to attending virtually? Most worship places, like I mentioned earlier, have done an excellent job of, only registering people prior to attendance, making sure that they don't exceed their limitations so that every household member is separated by 2 meters from other household members, preventing that crowding at entrances and exits. So far, we have seen occasional transmission at places of worship, but not. This has been, I think, the only single super spreader event. And I think, unfortunately, there were some situations both during the event and before and after that resulted in that happening. But I think this just shows that, while there are risks with any gathering, it can be done safely. This is the time to become smaller and for all of us to do a risk assessment, what is our risk, personal risk because of our age and health conditions, what are the risks to other people who are close to us, because we need to keep our bubble small. If we have parents or grandparents, again, do we forego attending in person so that we can keep others safe as well? But this is, I had said, we had to reset our bubble when school started, but now with fall, this is another time for us to reevaluate all the places we go to. How can we keep the number of places we go to small? And even when we are at a place of worship or at a social event, how do we minimize transmission?
Thank you. Dr. Laura, do you have a follow-up?
I do, yeah. We've received a report at CBC that there was a recent outbreak at the College of Medicine in Saskatoon at a ceremony on October 2nd to welcome new medical students. It may have been a source for an outbreak. What can you tell us about that?
So I'll make some initial comments and then ask Mr. Livingstone if he has any further information. I'm aware of at least two situations where there's a positive case in a university setting in the University of Saskatchewan, and then close contacts are quickly identified and isolated. It hasn't become a bigger transmission, and that's very similar to school settings. Obviously, most universities are online, but of course there are some professions where you have to train or attend in person. But the similar protocols that we have seen at workplaces or in schools are being followed. And in general, if there is a case who presents, the number of contacts have been small, and public health has been able to interrupt the transmission chain quickly. And because all the contacts have been isolated, there's no need to notify that publicly. But I'll just see if, Scott, you had anything further to add.
No, I'm not aware of a ceremony at the College of Medicine having anything to do with cases that I've been made aware of. So I have no other comment.
Thank you. Moderator, next caller, please.
Okay. We have Mickey Jurek with Global.
Mickey, can you hear us?
Yeah, I can hear you. If cases continue to rise at this rate, when are we expected to hit that threshold you mentioned earlier? And what are the tighter restrictions that would be implemented?
Yeah. So obviously there's a couple of things that we are looking at very closely. One is, of course, when you talk about metrics, our daily case numbers are very important. And as you know, they trended very low, 5 to 15 for many months. And even then, a lot of the cases were in localized outbreaks. They were in communal living settings, they were in the Northwest. But then what we've seen recently is that while we continue to have outbreaks linked to, for example, a gym, a very large outbreak linked to a worship event, we're also seeing sporadic cases throughout the province, so there's a bit of a change there. We're also seeing that the number of contacts are higher, so the public health investigations are more complex. So it's not just case numbers going up, but also the complexity of those transmission events. Some of that we knew would happen. We've had about 34 schools who've had a single case, and about 15 schools are now through that. They've gone through the 2-week period without any further transmission and are out at the other end. Each of those situations had maybe 3 or 4 close contacts who also stayed home. And then everyone's back in school. So some we expected, that's being managed, but we definitely want to watch what are some of the trends. And like I mentioned earlier, we are seeing an increasing trend in 15 to 39-year-olds, which is similar to other parts of Canada, the US, and Europe. And that's a demographic that I think we really need to reach out as friends and family to say, let's slow things down, stay home. If you're unwell, get tested, keep your number of close contacts small. So that's really important. Test positive rate, overall it's been less than 1%, but now in 15 to 39-year-olds it's hovering around that 2%, which is concerning, and certainly we don't want that to go even higher. So I think there's several things we're watching. Overall daily case numbers, do they stay high in a sustained fashion? But also, what are the transmission settings? And I mentioned several, places of worship with small clusters and occasionally large cluster, birthday parties, funerals, weddings, occasional clusters, sometimes large clusters, sometimes the whole, almost everyone who attended or more than half the people who attended get exposed. So again, what is happening there? And usually it's things aren't laid out well, people aren't physically distant, food isn't plated. So we just need to revisit these basic things and try to keep our overall numbers low, but also focus on those settings where transmission is more likely to happen.
Thank you. Follow-up, Mickey?
Yeah, I don't think that answered my question. I was just kind of wondering what the tighter restrictions would be if things do get worse.
Yeah. So again, we are constantly reviewing all the evidence from both the modeling that's done at the University of Saskatchewan in partnership with the Ministry of Health and the Saskatchewan Health Authority. We're doing the modeling that's done by the Public Health Agency, as well as the modeling that's done by groups in Europe and the US. We're also obviously monitoring what measures are being taken at what level of transmission and what the impact is. So obviously, like I mentioned earlier, 5 cases per 100,000, which for us would be 60 cases a day over several days, would force us to think that, what else can we do beyond what we've done already to slow things down. Some of it could be general recommendations, some of it could be, slowing down specific sectors, maybe earlier closure, or maybe going to maybe 50% capacity like in the earlier part of the reopen plan. Those are not easy decisions to make. They have an economic impact, but they are decisions that can be contemplated if our case numbers are high throughout for a consistent time period. So that's one thing. And obviously, unfortunately, in some parts of Europe primarily and some parts of Canada, when case numbers are much higher, consistent case numbers, more than 10 per 100,000, which for us would be very high case numbers when we think about it right now, more than 120 cases a day for several days. Obviously, that's when you start seeing pressures on the health system, on the hospital system. And that's when, unfortunately, you need to start then to save the health system, you want to start taking some tighter measures, which we all know have been taken, where gathering sizes come down to even smaller numbers, less than 10 or 5, where in some cases, some of the sectors that were later to reopen, bars, restaurants, gyms, unfortunately do have to close. Those are not easy decisions for any jurisdiction that has to do that. People's livelihoods are impacted, but those are metrics that we are following, and we are evaluating the impact that those have. But we will have to obviously look at the context in our setting. What is the geographical extent? If our numbers go high, which age groups are impacted? What are the venues where they are getting exposed or exposing others? So that all of that would have to come into consideration before any specific restrictions are taken in place.
Thank you. I think we have time for our last caller, if I have this right. Moderator?
Carol Thompson with CJWW.
Actually, my question has been answered, so I'm good.
All right. Well then, thank you, everyone. That will be our time today for today's COVID update. We will return to our probably regular scheduled time of Thursday next week, although we could host another if events dictate. Thank you, Dr. Shahab. Thank you, Mr. Livingstone, and have a good weekend, everyone.